Welcome to Prepare for Surgery at University Hospitals Bristol and Weston. Prepare for Surgery has been developed to support you through your preparation for and recovery from major surgery. We hope that watching this video will help you understand what to expect before and after having an operation. Today we will talk about preparing for surgery, or prehab, and how to recover better in hospital and when you get home. Prehabilitation, or prehab, is a term used to describe how your body can be prepared for surgery. In addition to thinking about your recovery, or rehabilitation phase, it is important to also think about the preparation, or prehabilitation phase. Evidence tells us that patients who are able to improve their health and activity levels before surgery reduce their risk of complications and recover more quickly. Patient empowerment.
Many healthcare professionals from different specialties will look after you before, during and after your surgery and work together with you to achieve a successful outcome. You are at the centre of everything that happens around your surgery, and with support from family, friends and specialist teams here, we hope you can get prepared and work hard to be as ready as you can for your operation. There are many changes you can make to reduce the risk of surgery. Even small changes can make a big difference. What you do now can have a really big impact on your recovery. Planning is really important. Talk to friends, family and neighbours about going into hospital. They can help you prepare and support you when you return home. Giving thought to practical things that you can arrange well before coming into hospital will help you recover well after your surgery and reduce stress. For example, what can you prepare at home to help make your recovery easier? Think about your mobility and sleeping arrangements at home. You could stock the freezer with easy-to-cook meals or have your over-the-counter pain medications available for when you get home. Who do you need to let know that you are going into hospital? Who will look after elderly relatives, children or pets if you have them? How will you get to and from hospital, and what do you need to pack? Think about how you will pass the time when you are here. Consider packing music, headphones, puzzles or books for your entertainment. Taking an active role in planning and preparing for your operation will help you feel in control and get back to normal more quickly.
Ready emotionally.
We understand that having surgery is a difficult time for many patients. It's very important for us to consider how you are feeling, thinking, and coping with your diagnosis and your treatment at all times. It is normal to feel anxious about coming into the hospital, and many people feel low in mood during their recovery. Everyone in the team will be open to discussing these aspects with you. Advice and information can help reduce anxiety, which will help you to have a positive approach to your surgery and to feel responsible for your recovery. Some patients find relaxation, mindfulness, and breathing exercises useful. There is a well-being toolkit in our website with links to the resources. We can also refer you to our psychology team if you would benefit from more formal support.
Eat well.
Eating a balanced and varied diet is important to provide all the nutrients needed for your health. Eating well before your operation will ensure your body has all the nourishment it needs to withstand the stress of surgery and aid recovery afterwards. A well-balanced diet supports your immune system and will help to minimise the risk of infection. We recommend trying to eat at least 3 meals per day and consider having some healthy snacks between your meals. We know that some patients can have problems with eating or losing weight because of the nature of their diagnosis. If this applies to you, please tell your doctor or nurse. They may refer you to see a dietitian or may prescribe you supplements high in calories and protein to take before your operation, which you can have alongside your usual meals.
In the 24 hours before surgery, it is important for you to follow the guidelines that we will give you, and to avoid excessively long periods of time without food or drink. If you don't have diabetes, you might be given carbohydrate-rich pre-op drinks to take at home. Research has shown that taking them as directed before surgery can reduce your thirst, hunger, and anxiety and help you recover more quickly.
Healthy choices.
As well as the long-term health problems associated with smoking, we know that smoking affects the immune system, which is responsible for healing. If you currently smoke, one of the best things you can do to improve your recovery is to stop, or at least cut down as much as possible. Stopping smoking is hard, especially during a stressful time, However, stopping or cutting down now reduces your risk of problems like chest or wound infections, will improve your healing, and potentially shorten your hospital stay. We know that stopping smoking is more likely to be a success if you get support and use nicotine replacement. So please talk to us or your GP about this. Alcohol can have many effects on the body, including reducing the function of your heart, causing a mild dehydration, and suppressing the immune system, therefore increasing the risk of infection and other complications after surgery. We suggest you stop drinking in the run-up to your surgery. If you are a heavy drinker, suddenly stopping can be dangerous. So discuss this with the nursing team in pre-assessment, who will help you to plan cutting down alcohol safely.
Assess medical needs.
Many medical conditions can affect recovery from surgery, so it's important to make sure that any known conditions are controlled as well as possible ahead of time. You'll be seen in the preoperative assessment department before the day of surgery. This is where we make sure that you are ready and fit for your procedure and that you know what to expect when you come into hospital. We may also require further tests and investigations to assess your medical fitness.
Better fitness.
Your heart and lungs have to work harder during and after an operation to help the body heal, much in the same way that they do if someone runs a race. No one would consider running a race without prior preparation. Similarly, it is important to do things before your surgery to prepare your body. The fitter you are before your operation, often the easier your recovery will be. Our physiotherapy prehab team are here to help get you more active before surgery. The team may assess your fitness in the pre-assessment department and for some patients develop a personalised exercise plan. In general, before your surgery you should aim to do 20 to 30 minutes of activity a day or to double the activity you currently do. Consider signing up to a local exercise class, gym, or walking group. Your GP should be able to direct you to these if you're unsure where to start looking. The preoperative assessment and preparing yourself for surgery video on our website has some suggested activities to consider if exercise isn't already part of your day-to-day life. We also demonstrate breathing exercises that we would like you to practice before surgery and perform regularly after your operation. Doing what you can to improve your fitness before surgery will help to reduce your risks of complications after surgery, reduce the length of hospital stay, increase the speed of your recovery from surgery, and improve your quality of life. And studies have shown improvements in patients' fitness after as little as 2 weeks increasing activity. We also know that regular physical activity helps to promote better quality sleep and helps manage stress, improve mood, and reduce anxiety. So we recommend getting started today. It's never too late, and every minute of increased activity counts.
Prehab helped me immensely, both pre-surgery and post-surgery. I don't think my recovery would have been anywhere near as good without that.
Enhanced recovery after surgery. Now that you have prepared for your surgery, let's have a look at what will happen after your operation. In the days after your surgery, there are several key things you can do while still on the ward to help yourself recover quickly. And it's all about dreaming. Dreaming stands for drinking, eating, and moving, which are the keys to your rapid recovery. Most patients should be able to start drinking, eating, and moving about on the day of or the day after their surgery. These basic functions not only make you feel more comfortable, but also help to speed up your recovery, reduce the incidence of complications, and importantly, contributes to improved satisfaction with your hospital stay. Pain management.
It is our job to ensure that any discomfort after surgery is manageable for you and doesn't hinder your ability to get on with activities that will help you recover well. Good pain relief is important for general well-being. It alleviates suffering and it helps you recover more quickly. However, it is important to understand that pain is a normal experience after surgery and that it will improve as tissues heal. And having your pain controlled is not the same as being pain-free. In the days after your operation, we will try to ensure that you are able to take deep breaths, cough, and be able to do exercises with the physiotherapists without too much discomfort. We may change pain medication or doses in response to your pain or potential side effects. A combination of painkillers may work better than taking one on its own. They should be taken at regular intervals to be most effective. Additional medication is routinely prescribed to prevent nausea and constipation. You should be able to sleep, relax, and interact with family, relatives, and staff. If you are struggling to manage these activities, it is important to let the team or the doctors and the acute pain service know. There are many ways to deliver pain relief. You may have tablets, capsules, or liquid to swallow. Suppositories, a small waxy pellet which is placed in your back passage or rectum. Intravenous injection or infusions given through a cannula, which is a short plastic tube, into your vein. We also use some more specialised pain relief methods after surgery, such as patient-controlled analgesia or PCA, which is medication that you can safely deliver yourself via a button and a lockout system that goes directly into your vein. You may also have a wound catheter or nerve blocks or an epidural, which all use local anaesthetic that acts to numb the nerves at the area to reduce the pain. Some pain medications have the potential to cause addiction, but this is very unlikely if taken as prescribed for a short period of time to relieve pain after surgery, and also if the medication is reduced as instructed. If you are concerned about addiction, talk to your doctors or us, the acute pain service.
Drinking.
It is important to keep hydrated and start drinking liquids as soon as you feel able. This helps your blood pressure and your kidneys. Many patients will be prescribed regular post-operative energy drinks to help with this. There are several flavours available and the nutrients they provide will support your recovery.
Eating.
Food helps with wound healing, provides you with energy, and also helps to stop nausea. You may find that your appetite is smaller than usual initially, but we would encourage you to eat little and often as soon as your team is happy for you to do so. After certain operations, some patients need to be fed by tubes that are placed into the stomach. If this applies to you, it will be discussed with you at your pre-operative appointments so that you know what to expect. The team will review this daily with the aim of getting you eating and drinking normally as soon as possible. Sandwiches or snacks are available 24 hours a day, so you don't need to wait for your next mealtime. You'll be offered meals 3 times per day. Try to eat something from each course. The changes in flavour can help stimulate your appetite. Try to take advantage of this. If you have any special dietary requirements or you are struggling to eat enough, please speak with your nurse or ward housekeeper so they can help you pick from our menus. We can cater for most special diets, so please do let us know if you have any special dietary requirements, and we will endeavour to meet your needs. There are choices for halal, Afro-Caribbean, kosher, Asian, vegetarian, vegan, gluten-free, and other allergen-free meals available.
Moving.
Getting moving after surgery is really important. It helps prevent problems with your lungs, reduces the risk of developing clots in your legs and lungs, gets your guts working, and can improve your mood. We aim to get you out of bed on the evening of or day after your operation. Sitting up helps you to take deep breaths and cough more easily. Your nurses and physiotherapists will help you to manage any lines and monitors that you are attached to. Practice your breathing exercises, supported coughing regularly after surgery. Do them whenever you remember, but at least once every hour. To visiting relatives, we would encourage you to remind and motivate. Engaging in these simple activities after your operation and working with the team of specialists looking after you on the ward will reduce your risk of complications after surgery and aid your recovery and help get you home sooner.
When you go home. Going home after an operation can seem daunting. Before you go home, your team will give you written information about what to expect during your recovery and how to manage any pain you might experience. This will also include anything to look out for and a number to call if you are worried. At home, try to continue with your prehab activity and aim to continue to exercise, building up slowly to your previous fitness levels. Pacing and rest are also important. It is normal for some days to go better than others. Ask your family and friends for support if they are able to. Depending on your operation, recovering from surgery may take many weeks. Using a recovery diary can help you to increase the amount of activity you do each day and will help you to track your progress. Setting daily goals can be useful and help to speed up your recovery. All these things will help you to see the progress you're making day by day. We would like to thank you for watching this video and for taking the time and effort to explore your role in better preparing for and recovering after your operation. Prepare for surgery. Start today to make a difference to your recovery and long-term health.